Hello, I'm Dr. Dennis McKenna. Today I'm joined again by John DePaula. JD, good to see you.
Hey, Dennis. Good to be here.
Great. Good to have you here. Today is Thursday, March 3rd, giving you the update from Albany Med. Anybody seen Fred?
I talked to Fred on Tuesday.
How's he doing?
Yeah, he's doing really, really well.
All right.
He is still doing good, still staying in touch. It's almost his vacation in Australia is coming to an end.
We got to get him back in studio once he gets back. It's great to have you here. All right, we have a lot to cover. Let's jump right into the graphs. We'll pop open the first one. These are cases in New York State identified with COVID. Numbers are incredibly moving in the right direction. Currently 1,832. John, at one point, as many as 18,000 in the state, right? So it's about 10% of when it was at its highest level. Next graph here is Capital Region. We currently have 130. Again, when compared to the highest number we had in the past, at one point that had been as high as 550. Again, you can clearly see on the graph, continuing to go down. Next graph here is specific to Albany Medical Center, admissions and discharges. The good news story here is now, on any given day, rather than having 10 or 15 or 20 admissions per day, we're looking at some days 1, 2, or 3. So that's obviously moving in the right direction. And then the next graph here shows what it looks like, the morning census here at Albany Medical Center, people in the hospital diagnosed with COVID. Again, clearly you can see from the graph that's coming down. That number currently today is 45, and I'll predict, and hopefully I'll be correct, next week we'll be in the 30s. So we'll be moving in the right direction. One more graph. People want to know about the variants. What variant is out there? As you can see here on the horizontal axis, it's time, and vertical axis represents the different types of variants. It's still 100% in this region, Omicron. There's a couple different subtypes, but it's all Omicron. So that's what we have there. John, let's talk about some data related to COVID and how it's affecting things here on this campus. One of the other numbers that people look at is what is the percent positive? So if someone is tested for COVID, are they positive for COVID? We call that the percent positive. And rather than taking one number in time, they do a 14-day rolling average. And we've been seeing that number has been as high as almost 30%. A couple months ago. It's been moving down steadily now for a while. And in the capital region now of the 8 counties, that 14-day rolling average percent positive is under 5%. We're somewhere in the 3.5 area. We have made a determination based on talking to our epidemiology colleagues that when we're under 5%, we can make some changes. So let me ask you, we've made a couple changes on the main campus and offsite related to masks. What are those changes?
Yes, Dennis. So what we've done is, in clinical areas, we have to stay masked. But in our non-clinical areas, for example, the college or some of our off-site locations like 1275 Broadway, we don't have to mask anymore. Now, what's a little bit confusing, but we're clear on it, is in areas that are shared by patients and staff, say our cafeteria, our hospital hallways, we got to stay masked in those areas as well.
Okay, makes great sense. Certainly consistent with guidance from the CDC, New York State Department of Health. So again, non-clinical spaces, unless they are main hallways or cafeterias, they don't have to wear the masks anymore.
Correct. That's good news.
For sure. Let's talk about testing. If you come in through the emergency department and you have to be admitted to the hospital in the past, or if you were coming in for an elective procedure, over the last year or so, we've been testing everybody for COVID. Are we still doing that?
We're not, Dennis. So now we've moved to a point where only if you're symptomatic and have some of the signs, you will have to have a COVID test, or if you've not been vaccinated.
Okay.
Those are the only two circumstances now where you have to be tested prior to admission or procedure.
All right, very good. And again, that's based on recommendations from our folks in infectious disease and epidemiology. And then lastly, a topic that's very important to me, I know it's very important to you,
It is.
Visitation, right? So I believe that having people come to the bedside is important for their physical health, their mental health, their spiritual health. Have we made any changes to visitation on this campus?
We have, Dennis.
Okay.
So we've increased from the number of visitors a patient can have from 1 to now 2.
Okay.
So it's an increase there. And also a key element is we're allowing those family visitors to kind of swap. So if a patient has a visitor prior, you can only have one person that had to remain that one person. Now we're up to 2 visitors per patient, and we can kind of change and go back and forth so more family members, more friends, more loved ones can come in and be with those patients. And again, our visiting hours are 10 a.m. to 8 p.m., 7 days a week.
Wonderful. Couple of things very quickly. Our security department here does a remarkable job of managing the folks coming in and out of the campus, so we want to thank them for their efforts there. And then lastly, John, you mentioned 2. We all know there are circumstances, sometimes very difficult and complex, that require more than 2 family members at the bedside. We call those compassionate exceptions, and those still exist, so we'll allow that. Okay, thank you. Today, John, I was able to participate early in the morning on a panel discussion at CDTA, and I was very pleased to be able to do that, and I thank them for the opportunity to do that. We talked about the way in which Albany Medical Center and CDTA have collaborated over these last many years. So we have something called the Universal Access Program. So if you use your ID badge, you can actually get on a CDTA bus and be transported. We have 11,000 employees as part of Albany Medical Center. Do you have any idea how many times a month members of our workforce access that Universal Access Program?
I got to tell you, Dennis, I honestly don't.
So it's 20,000 times a month. Isn't that remarkable? The overwhelming majority of those are using it to come into work or go home, right? So we have people that come in at 3 o'clock in the morning. We have people that come in 11 o'clock at night. The message to the folks at CDTA was the partnership we have. Allowed our essential employees to come in over the last year. And of course, their bus drivers and everyone who worked on the buses were essential as well. So we thank them for that. And we thank them for the partnership they had with us with the vaccine rollout. They were incredible as far as their willingness to move either individuals with disabilities or individuals who perhaps lived in senior housing to vaccine sites. It was great. So we wanted to thank them for the opportunity to be part of that panel discussion.
Sounds good.
All right, John, a lot of talk lately about wellness or some information on the intranet. I know you do senior rounding every day. You're talking about wellness. You want to pick that up a little bit for me?
Sure thing, Dennis. I mean, all of our senior leaders that go around and interact with our staff, one of the key elements is, just checking in on them, making sure they're doing okay. It's been 2 years since COVID has hit. Our staff has done a remarkable job in taking care of patients. And, as we know in all of healthcare, they're feeling stressed. And we want to make sure their well-being is a priority to us. So a lot of us will ask them how they're doing, how they're feeling. And really, although they're tired, they're weathering the storm and doing well and taking advantage of some of the opportunities that we have here in terms of helping our employees with wellness.
Absolutely, John. And you've been doing such a remarkable job out there with the senior rounding and checking in on folks. The letter that I send out every month, this month's theme is on wellness. And we point to the fact that we offer a significant list of resources that can help our workforce. And we now collated them all in one location. It's on the intranet. It's viewable internally. It's viewable externally. There's a QR code that was in the letter. It's also available. We're going to be handing those cards out. The message to the workforce is, we hear you. We have lots of resources available for you for wellness. We'll have more in the future, but we encourage you to check out that site and see all the different offerings we have.
And it'll be great to start hanging out those pamphlets, Dennis. I think tomorrow, in fact, Kathy Palazzi's pulled those together and we'll start handing them out tomorrow. So we'll really get the word out what all those resources are.
So speaking of wellness, speaking of the intranet page, there was something today I encourage you to check out. There's a new offering for those members of the Albany Med workforce who are part of our health plan and their families. It's called APTI Health. That's spelled APTI Health. This is virtual, on-demand, world-class access to mental health care that can be done over an individual's smartphone or a computer. And it's a partnership with APTI Health and CDPHP. And I think it's cutting edge, but it also has a very personal touch. And for those individuals who want to access mental health, this is an offering that we now make available to them.
Yeah, it's another great option for our staff to take advantage of in terms of wellness, not only for them, but for family members as well. Right. So another great resource in partnership with CDPHP.
Yeah, absolutely. And honestly, one thing we learned during the pandemic when we flipped from in-person to virtual for a lot of visits is for mental health visits, there was very few cancellations for patients if they had the opportunity to do it virtual. And so it's a convenient way for individuals to get the care they need. We encourage them to take advantage of that. All right, there's some voting going on, and the last day is tomorrow. So this is the Times Union Best Of, and obviously the category we're in is Best Hospital. Now, I voted.
So did I.
Who do you think I voted for?
Same as who I voted
Absolutely, for the best hospital, Albany Medical Center Hospital. So we encourage you to vote, and the deadline is tomorrow. We're very proud of our workforce because in the last many years we've received this distinction many times, and it's because of all of you. So if you haven't voted, please do so.
Yeah, and Dennis, obviously I'm biased, but you know the incredible work that our staff does, the complexity of care that we offer here in the region, really second to none. And to hear the gratitude of our patients and family members, I have no problem with the vote I cast.
For sure. The reason why we're recognized as the best hospital year over year is because of our workforce. And so let's talk about a couple of those people. Our most recent Daisy Award winner is a pediatric primary care nurse by the name of Erica Regensenberger. So you can see Erica's picture there. And John, read a little bit about what the nominator said about Erica.
Sure thing, Dennis. Erica was nominated by a mom whose children visited Erica's practice. She wrote, quote, "For me, as a nurse myself, I know how hard it is to manage patients' anxiety. As a mom, I cannot express my thanks enough to Erica for her kindness, caring, compassion, and patience. Erica is truly the definition of an amazing nurse." In terms of caring for her daughter, mom referenced, she held her hand and asked her to take a slow, deep breath and really guided her through her anxiety. And regarding the care of her son, mom wrote, she was kind, direct, and honest. She said, "I have the shot to give you. It's going to pinch for 1 second and then we're done." She held his hand as she did my daughter, walked him through some calming techniques, deep breathing, positive thoughts. Erica walked him through the process about 3 times, never seeming frustrated. Erica was able to quickly administer the shot without a peep from my son. Great job, Erica.
Yeah, for sure. Wonderful job. We're so proud every month to talk about our Daisy Award winners. Erica deserves that. Congratulations to her. Thank you so very much, Erica. Speaking of nurses and recognition, you have an opportunity to nominate nurses for our annual, what we call our Pillars of Nursing. Every year there's 6 or 7 nurses that are recognized. This is always an extraordinary event, wonderful stories. You can look on the internet for that. And lastly, the Eye Care Award. So we had our Eye Care Award winners announced the other day. We actually had 3. The first 2 are emergency medicine physicians, Dr. Greg Wu and Dr. Marissa Potenza. Dr. Wu also works in our medical ICU as an intensive care doctor, along with being an emergency physician. They're the 2 physicians who established and worked on our monoclonal antibody clinic, which has been a remarkable way in which we've delivered that therapy to well over several thousand individuals in the capital region who were diagnosed with COVID, but by getting that medication didn't have to come to the hospital. They partnered with the apheresis nurses and bed access. They were very quick to praise them as well. We congratulate Drs. Potenza and Wu. And there's another winner as well.
There is, Dennis. Allison Johnson. Allison's an LPN in our behavioral health, our behavioral and development pediatric clinic. She was key to our success in COVID-19 employee testing. She did a wonderful, wonderful job in terms of scheduling, ordering supplies, and managing the workflow and process. And as we saw on Monday when she came down to accept her award, her favorite color is pink.
Yeah.
She was dressed head to toe in pink.
She was, yeah. She was also extremely authentic and genuine and just this remarkable personality. And she was moved by that. And I think it was wonderful that we recognized her. And she's a great employee.
Yeah.
So congratulations to her. All right, so we covered a lot. That was great. Anything else you want to say?
No, I think we covered enough,
We did.
Dennis.
All right, very good. Well, rolling into the weekend, we say it every Thursday to those that are here working around the clock 24/7 on the weekend. We thank you. We appreciate you now more than ever. And we'll be back here again next week.
Sounds good,
All right,
Dennis.
very good. Thanks, John, for joining us very much.
Sure thing.
We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.